Thank you for choosing Florida Joint Care Institute to have your surgery. It is a privilege to be part of the healing process, and I look forward to helping you reach your goals. We continue to embrace the newest technologies available using evidence-based medicine techniques and practices. This video is designed to complement the discussion that we have already had and to help you understand as we move towards surgery and embrace the rapid recovery program. Hip replacement technology has been widely administered for more than 5 decades, and the technology continues to improve and has among the highest patient satisfaction of any operation performed. The surgery involves removing the ball and replacing it with a titanium stem with a metal or a ceramic ball, as well as resurfacing the socket with a titanium shell using a highly cross-linked polyethylene liner. These bearing options provide consistent results with very low rates of component complications and have demonstrated more than 20 years of success for the majority of patients. As your surgeon, we have already discussed treatment options, including the alternatives. Now it is time to prepare for the surgery. The 2 basic aspects of this operation are technically performing the operation correctly, but also avoiding complications. This is a team approach, and it requires coordination between me, the supporting staff, you, the patient, and a coach. The coach may be a spouse or a friend who will be available particularly during the first couple of weeks after surgery to ensure appropriate care can be followed and appointments with us and physical therapy can be made. We encourage the coach to attend your visits with you and to have a good understanding of the plan of care. Surgical planning begins with our scheduler, who will give you the preoperative appointments and to review the timeline of events before surgery. You will have a visit with my physician assistant to have a physical performed, to review your medical history, identify risks and discuss how to minimize them, and answer any outstanding questions. We encourage you to write down your questions that you may have so that we may appropriately address them at this visit. We want you to have a thorough understanding of the process moving forward to avoid any confusion or lapse in your care. We have a unique program here at Florida Joint Care Institute where we use an evidence-based medicine approach to create a rapid recovery program, minimizing pain and accelerating recovery while minimizing the risks associated with surgery. As with any surgery, there's always risk. With careful planning, this can be minimized, and specific risk factors you may have will be reviewed with you prior to the surgery. There is a small risk of infection. We use private rooms for our patients, and we screen for commonly carried infections in the community beforehand so that they may be treated. We use modern antiseptics, and you may have received a disinfectant soap prior to the surgery. We also use specialized isolation gowns and hoods during the surgery. Afterwards, you'll have a small island dressing that seals over the wound, and it is important to keep this bandage intact. The wound will be checked by us approximately 2 weeks after the surgery. Sometimes sutures are used below or above the skin, and this may depend upon skin thickness. There is always some bleeding with surgery. However, the risk of transfusion with modern techniques has dropped significantly. Blood transfusions are now rarely necessary. Injury to any major nerve or vessel is also very unusual. There is a risk of blood clot after joint replacement surgery. Blood thinners such as heparin or Coumadin used to be routinely prescribed, but if you've never had a blood clot and you're not otherwise predisposed to blood clots, then you may be a candidate for a home leg compression device along with an aspirin after surgery. This has been shown to be very effective at preventing blood clots, while minimizing the risks of bleeding associated with the more traditional blood thinners. It is very important to follow through with these prevention protocols to prevent a blood clot formation, which could migrate to the lungs and potentially cause serious problems. Our careful planning involves digital x-rays, which are calibrated and can be digitally templated During surgery, trial components are used to identify appropriate restoration of anatomy, including length and position. Using these multiple techniques allows accurate reproduction of anatomy and leg length to minimize the chance of such discrepancies. During the surgery, it is possible to have a fracture of the bone during preparation. As your surgeon, I always prepare to have backup instrumentation necessary to address these scenarios should they occur. You will have had a medical evaluation prior to the surgery. There's always some stress placed on the body during the surgical process. You will have a brilliant team of providers, including an anesthesia team, to monitor you throughout the entire procedure. Medical complications such as a heart attack or stroke or dying during the procedure are extremely rare unless there are underlying significant conditions that might otherwise predispose this to happen under stress. I review all of these risks with you, not just to inform you, but to let you know that we think about them as much as you do. By doing so, we can anticipate and minimize any potential complication from happening. With careful planning, you should feel very comfortable the day of surgery. Our team is here to make sure that you have a good experience. I am your surgeon, but it is a team approach, collaboratively with the anesthesia team, the nurses, the technicians, to ensure that you have a safe operation. You'll be taken into the preoperative holding area where your nurse will greet you and help prepare for surgery. This will involve reviewing your operation to be performed, getting changed, and having an IV placed. You will also see your anesthesia provider and myself before going into our state-of-the-art operating suite. You will have the opportunity to have any remaining questions answered prior to your operation. Your anesthesia provider will confirm your anesthesia plan and will remain with you to ensure your comfort at all times. We are also very proactive at preventing pain before it occurs. This involves using specialized anesthesia techniques during the operation. Local anesthetics are also used during the surgery that may last up to 3 days. You will also be given 1 or more prescriptions to help treat pain after surgery. It is important to have these filled and ready shortly after discharge so that pain control is not interrupted. A walker is typically used for the first 2 weeks. The duration of use may vary from one person to the next. Working with your therapist, you will progress off the walker once your gait is stable enough to tolerate safe mobilization. The majority of people see approximately 85% of their recovery within the first 6 weeks. This is the point by which many activities may be resumed, including low-impact sports and returning to work. If this is your right hip being replaced, then you should also consider avoiding driving for at least 6 weeks, as brake reaction timing has been shown to be impaired during this period. Thereafter, you will continue to see improvement throughout the course of the year if you continue to mobilize and perform the exercises which should be adopted to a wellness program. Again, thank you for choosing us to be part of your care. It is our pleasure to welcome you to our unique Rapid Recovery Program. We always remain available to help answer any questions you may have, and you should have been given a concierge number as a direct line to help address any concerns that you may have after the surgery is performed.